you didn't try to force this narrative of like, they want to see this and they want to see that. And you just said what literally was your journey. Mission Accepted Season 3. How you doing today?
I'm doing great.
That is fantastic. I'm excited to be talking with you today to look at your application, to share what helped you be successful to get into medical school. How's medical school going for you?
It's going well. I've actually enjoyed it, I guess, a lot more than I thought I would. It's great. I'm in the tail end of preclinical right now.
Yeah.
So last push.
The last push. Very exciting. That is awesome. What do you think helped you be successful in your application process?
I had a lot of strong clinical experience going into the application. I had a strong GPA, which I think made up for multiple MCAT attempts, so that I was still competent in material. I also think I gave good interviews. I was accepted to all 3 schools I interviewed at.
First application cycle?
Yes.
One and done, 3 interviews, 3 acceptances. How did you end up choosing which school that you ended up going to?
It was my top choice out of the 3. So I was accepted to all 3 South Carolina in-state schools, and it was my top out of the 3. Has a heavier research focus, and I'm leaning towards something a little bit more competitive. I knew that was going to be important.
Okay.
And they have protected research time.
As a second year now, not regarding that decision?
No, I love it. I love Charleston. It's a great city to live in. I also have a good support system here too, so that kind of helped, I guess, push me towards it.
Yeah, awesome. All right, well, I'm excited to dive in to your application, and we'll see what I like about it and what I have to say about it. So let's take a look. So I love it. First thing you'll see, again, you're a second year student, so 2021 entering class. Most of the mission accepted are for 2022. So that's the first thing. Submitted early, which is obviously fantastic with rolling admissions and how important that is. As we scroll down here, all of the general demographic info is kind of redacted out, but we can see here you didn't mark yourself as disadvantaged. But AMCAS did mark you as EO1, and again, just for people, that is based on parent information, again, which we have redacted out. So that's just a general automated qualifier. No red flags, which is fantastic. We like to not see red flags. And then we get into some grades. We have one dual enrollment course here. Got that A-, struggling right off the bat with that 3.7 GPA. And then we see lots of A's. There's a B+ in there, some more B's, but mostly A's. So I'm assuming your GPA is somewhere around 3.9-ish.
3.93.
Yeah, so 3.86, 3.93. That's always like my fun little party trick is I like to scroll through the grades and try to guesstimate what the GPA is going to be like, and so yeah, relatively close.
Yeah, I say that confidently because I'm still bitter about it.
Why 3.93?
Yes.
What did you want?
If it was a 3.95, I would have graduated summa cum laude instead of magna. So.
Oh, darn. And guess what? It would have made 0 difference in your life at the end of the day.
Exactly.
Yeah. Absolutely no difference. All right. So obviously we see great GPA here. And I just want to point out, looking at high school, obviously that 3.7 from the A-, having a 4.0 to a 3.71, a lot of people will be like, uh-oh, I have a downward trend. That is not a downward trend. That is just called not being perfect. A 3.7 is still a fantastic GPA. A 3.8 is a fantastic GPA. This is not a downward trend at all. But you did recover and got your 4.0, so good job. Finishing strong that last semester, 4.0 across the board. So it was really, it was this 3.71 that kind of brought you down the biggest Dang.
Anatomy and physiology.
A&P got it. Okay.
Yep.
All right. How can you be a doctor if you can't even get straight A's in A&P?
That's what I'm saying. I don't know.
Man, they made a mistake. All right. So obviously GPA perspective, not a concern. We get to grades. And so this is interesting. 503 to start. A lot of people will look at that 503. They'll look at this 386 science GPA and they'll go, something's not computing here. What was the struggle with the MCAT first time around?
I am not a good standardized test taker. I have test anxiety. I still struggle with it now in med school. Yeah, I think it was just figuring out not necessarily the material, but how to take the test.
Yeah.
Which the last time around I got UWorld, and that's where things went up.
Nice. So UWorld for the win. All right.
Yeah.
You sure it wasn't the MCAT podcast? Because I'm pretty sure the MCAT podcast had to play a part somewhere. Darn it.
Oh, I definitely listened to that too.
Okay, good. All right. So that's interesting. So test anxiety, but obviously from a college course perspective, and unless you were dealing with lots of test anxiety and still crushed all of your tests, your GPA was good there. Is it standardized testing that is concerning for you? And then in med school, obviously there's a big standardized test, several of them that you will be taking relatively soon, both from USMLE Step 1, which thankfully is pass-fail now, but still a really hard test. Very different than the MCAT, thankfully. During your clinical rotations, I'm not sure what your school does in terms of, we would have the shelf exams. Yeah. So those are standardized tests again. Have you thought about how to approach those tests, knowing your history with standardized tests?
I'm getting a lot of help from our testing center, and I'm on an upward trend with my just block exams right now and tackling kind of the test anxiety, and knowing it's a problem. I'm probably going to tackle dedicated a little bit differently.
Yeah.
I think knowing it's a problem in general is kind of the best thing for me.
Yeah.
Right now.
Accepting it, right? It's just accepting the way that your body reacts and your brain works in these situations, and just going, okay, I know this is who I am. What am I going to do to work on it? Versus that's not me. That's not me. I don't have that.
And I think I was in denial a little bit about it. But we're tackling it. I'm talking to lots of people about it, which is good. I started running the morning of exams, which my friends think is crazy, but it's really helped.
Running and those endorphins are phenomenal for a lot of stress relief. So that's great. So obviously you took the test 6 months later and didn't really improve much, 503 to 505. And then you mentioned UWorld being kind of one of the biggest contributing factors to that 511. Anything else big there? Did like Neo in the Matrix, where you just kind of saw everything happening, you understood it better?
See, that last test was the shortened one too. So I don't know
so you
if
cheated.
that had anything. yeah. Don't tell anyone. I don't know if that maybe had something to do with it. It was the length of the exam that was getting me. I was tired by the end.
Which I would probably say probably not, because that's at the very beginning of the test. 124.
Chem and physics section was never my strong
Not your
suit,
friend.
Clearly.
Yeah. Okay.
I think also it was the test anxiety. I had a lot less stress surrounding me the last time I took it. I was just more relaxed going into it. I kind of believed in myself a little bit more.
Good.
I think probably had something to do with it.
Yeah, well, you were probably less worried about the test and more worried about COVID. It's like,
probably.
Yes. Okay, got it.
And I had a full-time job, so it was, I don't know.
All right. Well, whatever it did worked. During your 3 interviews that you had, a lot of students are concerned, and there's a lot of myths out there that are perpetuated that you can only take the MCAT once, and if you take it more than once, the medical schools are not going to trust you and they're not going to believe in you. Did taking the MCAT 3 times come up at all in any of your interviews?
I think it came up once because I brought it up. Somebody asked me what I thought like a weakness was in my application maybe, or a something like that.
Yeah.
And I had brought up the 3 MCAT attempts and they just asked me what I had learned from it.
Yeah.
And I told them I learned that I needed to study through question-based learning rather than, just looking at material, and they appreciated that. So.
Wait a minute. So let me get this straight. You, as a human being, talked about some failure and what you did, how you learned from that failure to improve moving forward.
Crazy how that works.
And they accepted that as an answer? Wow, it's amazing. It's crazy. You're not supposed to be perfect? Oh, I had this all wrong. All right.
And while we're also on that note, I have 1 W also on my transcript, which I think you breezed through, and that didn't get brought up once.
Wait, let's go back and look. Because the W really matters, and a lot depends on... Not at all. They allowed you to withdraw from physics. Wow. How can you ever be a doctor if you had to withdraw from physics?
It's crazy. It just forces and everything.
It just amazes me. How can you not know how fast something is gonna take to go up a slide with a coefficient of friction of whatever? Oh man, ramps and slides, man, ramps and slides. All right, and it's just obviously poking fun at that. There's so much stress in this process, but these little tiny things just don't matter, right? They just don't matter in the grand scheme of things. So, awesome. Thanks for playing along with that. So, looking at activity sections, we see here some awards and honors. You did not have the summa cum laude on there, which obviously is a huge failure and red flag. I would have probably brought that up in your interviews as well. Very easy way of just listing things, which is great. We have clinical experience, which is awesome. I'm concerned the clinical experience there, obviously this is only the second activity here, was started just a month before the applications, obviously planning to do it full time with those total hours. So my hope is that we come down and we see some other clinical experience, and I'll just scroll down, research, personal touch volunteer. So there's some medical clinical that you were doing for a while, marking it as the most meaningful. So that's typically how I'll scan through an application pretty quickly. Is great. I see medical clinical. It started very late, because remember, if we look at submission date, so you started about a month before. But you got it. You had some before, so now I have that concern out of my way. Now I can look at it. So you are working as a medical assistant, and right off the bat, at the front desk, I check in patients, collect copay, schedule new patients, merge referrals. So very duty-based. I would probably just completely ignore that on an application. You're marking it as medical clinical. You're putting it medical assistant. Medical assistant is obviously a very generic term that can be used a lot, but typically we think of medical assistants as the one bringing the patients back and weighing them, taking vitals, what are you here for, putting in some chief complaint stuff in the EMR. So putting in the front desk stuff is just a distraction from that. So for everyone watching, if you have these multiple roles, I would probably just ignore as much of the non-clinical stuff as possible. So pretty duty-based in terms of what you're doing. I love to see anecdotes. I love to see stories of patient interactions and impact that you have. But you got clinical, which is awesome. So we have this other thing, 25 hours here, community service volunteer, general support medical. I would love to see like a little bit more specific, like what that is. Because I'm like, general support medical, what is that? So on the first day, patients began to line up their cars, transform Tennessee Gymnasium into dental, medical, eye clinic. Okay, so you're volunteering at a medical clinic, assisting women's health visits, pap smears. Yeah, so this would have been awesome. This looks like almost like a pop-up clinic, right? And so potentially just putting like clinic, like pop-up clinic volunteer or women's health clinic volunteer as a more specific term. And these are fun, right? A lot of times students get very scared around like how to name these. And there's no rules. That's the fun thing about this. From my perspective, there's no rules. It's stressful from the student's perspective. Like, what if they think I'm lying, or what if they think I'm exaggerating? Like, just put whatever you want there, right? You're a women's health clinic volunteer. Awesome. So that potentially would be medical clinical, right? Depending on what you're doing.
Yeah.
And I probably would have listed that as medical clinical as well.
I feel like that is the biggest thing when you're doing this. You're like, I don't want anybody to think I'm lying and speaking the truth.
It's the biggest fear that I think students have around this, and what causes them to be so tight and strict with their wording that it's like, I have no idea what you're saying, but that was my exact title. I'm like, who cares what your title was? Like, what did you do? Tell me that. So that's okay. Again, very common things that students do in this process. Pediatric externship. So checking in patients. So we have this general theme of some admin stuff. You were introduced to new challenges, learning about missed appointments, and were late because of all of these other, right? These social determinants of health, as they're known. And so very interesting to bring those up, talk about what you learned, which is awesome. The goal, or not the goal, the experience type here you listed as other. Why other versus paid non-clinical or volunteer non-clinical? Or
it should have probably been volunteer non-clinical. It was on my transcript because I got first credit for it.
Aha. Okay.
So I think that's why I ended up doing the other, because it was.
Yeah. And so tell me that process, because again, that scares students of like, this section is called the kind of activities section. Now, we, outside of the AMCAS application, generally refer to it as your extracurricular activities. But this was curricular. And I think a lot of students are like, oh, I can't put school stuff on there. I'm like, well, technically, I don't think you're not allowed to. We just generally refer to it as the extracurricular section. Did you go back and forth with anyone? Should I put it on there? Should I not put it on there?
I got a little bit nervous because people talk about this concept of like double dipping, but I didn't get to talk about the experience with it just being listed on my transcript was my thought process. They're just going to see this. I don't even know what it was listed as. You wouldn't even have known that it was an externship.
Yeah.
So I wanted to be able to talk about the actual experience, and I didn't think I was going to be faulted for that necessarily.
Yeah. Yeah, and again, I think unless there's like a gross misrepresentation of what this is, like the example I always come to is someone literally was a janitor in the hospital and marked it as clinical experience because he said, like, I'm in the hospital, that's clinical experience. And no. And so someone looking at that will go, yeah, that doesn't fly here. Looking at this, having study abroad, which is, again, curricular, but having study abroad on the application, there's probably nothing wrong with that. A lot of students put research that's part of their coursework in their application as research. There's nothing wrong with that. Shadowing. We love shadowing. 60 hours, lots of time here. And just listing them. Perfect, right? That's all you got to do here. Shadowing, not super impactful. You don't need to worry about listing or having stories for everything. Student council, advisory council, just talking about what you're doing here. Exercise science club, woohoo! Being a voice for peers, so obviously strong communication stuff there, strong leadership skills, which you're marking it as leadership. And then the transformation going from kind of just a rep to the chair, which is great. So good growth there. Undergraduate intern, so again, potentially a little more school-related stuff as part of your schooling. And then you mark this one as most meaningful. I'm assuming other, again, is because it was part of schoolwork. Is that the thought process?
Yeah.
Okay. Again, medical assistant role, firsthand, working with the doctor and patients, which is great. Again, more duties, job duty stuff. And I like showing this because you got 3 interviews. A lot of how I discuss the activity section specifically in terms of like, tell me a story, give me an anecdote, show me your impact. Like that is, in my opinion, the best way to show who you are. But this works too, because these people reviewing applications don't have a ton of time, and they see this and like, great, yep, medical assistant, yep, got it, okay, good, you got some experience, you're around doctors, you're around patients, awesome, stats are good, great, okay, you look awesome, let's bring you in. Right? Not every single student who's getting interviews, getting acceptances, does it the way that I recommend it. And so just to show you, right, you don't have to. There's what I recommend. There's what other people recommend. There's what works for you, and go for it. So you have some job duties here, but then you do, right? You do get into the little bit of an anecdote here with Marie, and I love the asterisks. So I would, instead of an asterisk, I would recommend the quotes. Just, it's one extra character, because typically with asterisks, what do? Right, we have
something at the end.
Yeah, we have to go look for something. Oh, what did the asterisks mean? And so quotes typically mean like not really. And so that's probably what I would do there. But asterisks works. They understand what you're saying here, which is awesome. And then having this patient story is great, and showing your impact here as much as possible. Right, just talking about visibly nervous, took her medical history, describing previous treatment options, made her break down and cry. Her husband was suffering from Alzheimer's. And so ideally, as I'm reading this, what I'm looking for is, okay, where were you here? And I don't see anything, right? As a non-surgical office, it was our obligation to offer every alternative. I would have loved to see you outside of the I learned statements. I would have loved to see you like take her hand to console her, to show her some compassion. That's the best way to turn this anecdote into showing who you are. Learning stuff is great. We all learn, obviously, along this journey. So that's that one. We have some research, which is awesome. Research is always good to have. Not necessary, but good to have. First MRI scan I shadowed was intriguing. A larger impact on me. I was witnessing the frustration over tasks most people take for granted. So again, Joe, so a little anecdote here. Going through this journey, and you're collecting, analyzing data, looking back at Joe and saying, and then summarizing in a poster, which is awesome. That was yet to be discussed, right? Okay, personal touch volunteer, again, medical clinical for a couple years, so not a ton of time, 200 hours. Over the course of a year and a half is, I don't know, what, 12, 15 hours a month or so. So that's actually not bad. Not terrible. And then marking this as most meaningful, because hopefully it was a most meaningful time in your life. And you have, again, getting into another little anecdote talking about what you're doing here. So your general kind of structure is for these most meaningfuls. I'll give you a little bit more job duty stuff here at the top, and I'll get more into some anecdotes at the bottom, which is a very common way of doing that.
That's kind of what I was going for there. Especially, I think with this one, I might have in the top part talked about how I ended up training volunteers to show kind of the growth through that as well.
Yeah. Yeah, you mentoring here. Teaching, tutoring, teaching assistant. So this one is the most meaningful. So here's the interesting. I'll ask you this. So 4 months, 80 hours, so 20 hours a month, roughly. If my math checks out, 4 times 20, yes. Relatively small number of hours. What was most meaningful for you here to mark this as most meaningful? Outside of maybe you're trying to like, ooh, they're going to see teaching and I'm interested in academic medicine. And what was the goal here?
I feel like I was trying to kind of weave this mentorship part of me through my application. And this was one of the first experiences that kind of kickstarted that for me. I was a leader for a freshman university 101 class. So that's why it really was most meaningful.
Yeah.
I don't know.
Yeah.
Other than that.
And that's an okay answer, right? And the fact that you said I was trying to weave this narrative, well, no, you weren't. You were just telling your journey and your story, and that's just what you happen to do. And that's the narrative that your story is portraying or telling is that you are someone who likes to be a mentor, that likes to guide, that likes to be a leader. And that's perfectly fine without you having to forcefully craft that. So that's good. All right. And you talked about it, right? An advisor, mentor, advocate. Awesome. I love numbers, right? Showing the type of impact that you had on the students, how many students, all that fun stuff. So again, little anecdotes here with stories of students, which is awesome. Student volunteer, going back several more years and serving meals to families, siblings, toys, coloring books, awesome stuff. So it looks like you're in a clinical setting here, almost like a child life services, child life volunteer.
Yes, it was with Ronald McDonald House in our children's hospital. They have a Ronald McDonald House room.
Awesome. Okay, so you're hanging out in the room where the families are. Got it. Okay.
Sometimes kids would come down, or like siblings and things like that.
Yeah. Awesome. Okay. Yeah. So probably not medical clinical. Good. All right. And again, nice little anecdote there. And hobbies. I love having hobbies on there, which is awesome. And you have lots. You chose not to give it hours. I've seen people with hobbies that have like 20,000 hours. I'm like, sure, why not? Right? You've been doing it since you were 3. I guess that is right. There's no right answer. I think 0 is perfectly fine. Obviously, if you're doing it for 18 years, probably a lot of hours have gone into that role. So very easy to leave at 0. Let me see. The one thing, and I'll look at this, the one thing that I typically like to see with hobbies is not trying to force a narrative of like, ooh, being a dancer has helped me with my dedication, blah, blah, blah. So let's see what you did here. 2 older brothers, just ballet over t-ball, so a little humor, which is awesome. Tap, jazz, contemporary, and trying to figure out all of them. So you loved all of them. 2 left feet, apparently. You had issues in anatomy and physiology, not understanding that people literally don't have 2 left feet, which is why you struggled there. That's okay. I slowly improved, won competitions, completed summer intensive program, awesome, and dance captain. Could not give up a large part of myself. So yeah, so you didn't try to take it and go, this is going to prepare me for medicine in this way. So awesome. All right. So then we get to the personal statement. So activities, great. You got clinical experience, got shadowing, all that fun stuff.
I might do that. I might do that with ballet and the personal statement.
All
right. I can't remember.
Awesome. All right. We'll find it. What was your goal with the personal statement?
Did want to talk about ballet. That was one thing because it is the reason I think I am who I am. So that's how I opened it up. And then I did think I had strong clinical experiences. So I wanted to talk about those and how they impacted me.
Okay. Perfect. All right. So yeah, so nice little showing here, right? Pointing your toes and smiling and all of that fun stuff. You're trying to figure out what's going on here with your body, with anatomy, physiology, with mechanics. So you're basically saying, hey, me being a dancer has led to this curiosity of figuring out what's going on with my body, let alone other people's bodies. So it makes complete sense to go there. Trying to figure out what's going on, right? Physical therapy was a career best suited for you, and figuring out what's going on. And that's okay to say this, right? A lot of students are fearful of like, oh, if I say that I was interested in physical therapy to start, they're not going to believe me that I want to be a doctor because I didn't come out of the womb with a stethoscope and a white coat on, and they're just not going to accept me. Like, I've literally had these conversations with people. I'm like, come on, it's okay. So dad is sick. And so here's where a little bit more comes in. It's more than just body mechanics. It's body physiology, pathophysiology coming in. And even like my new way of reviewing these for the show is literally just reading this for the first time with you to give you kind of real and everyone else watching kind of real feedback of like, here's what I'm picking up just right off the bat. Because remember, these reviewers don't have a lot of time to read 100, 200 applications. And so when I see like key things like that, I immediately go, great, I understand. Dad got sick. This led you down a path. I don't need to read the rest of the paragraph. We'll scan through it, but that alone tells me, great, I know what's going on here. Not cancer again, right? Strong words here. So something had already happened, and hoping that it's not cancer again. Science was supposed to have all the answers to alleviate family's pain. Again, very common path for someone to get to this point right here where I go to the very end and go, okay, what's the reflection? Why are you telling me this? Awesome. Started with body mechanics, what's going on, ballet, dance, physical therapy makes complete sense. And then health issues in the family go, physical therapy can't cure cancer. What else is out there? Oh, medicine. And you go down that path because you told me you're a first-generation student with little understanding, and it took you a little while to get here. That's perfectly fine. That is great to help the reader understand that journey. All right.
That's how it played out in my head. So I'm glad it came across that way.
And honestly, that makes it the easiest because you just basically told me the truth, right? You didn't try to force this narrative of like they want to see this and they want to see that, and like you just said what literally was your journey. I mean, you crafted it a little bit. You made it a little bit engaging, but that's what happened. It's easy, right? It's simple. It's not easy. So then again, this body mechanics, so basically what I just said, right? Guiding me in this new path. Interning in ortho. You want to be an ortho bro.
Unfortunately.
So very, very common, right? That was my path too. Physical therapy to ortho. So you close your eyes. Ortho can be involved in cancer as well. There are orthopedic cancer docs. So again, good visuals here. Close my eyes, move my hands across the patient's knee to mark the injection site. Hopefully you opened your eyes before you marked the site, or else maybe you're going into the wrong place. Again, good writing here, right? Tense leg hanging from the exam table, stream of fresh blood. So I'm just glancing through this going, great visuals. I see what's going on, all this fun stuff. And then you get to, again, the takeaway that I'm jumping to that I want to see is, why was this impactful for you? So, right? So you're inspired by the way a routine intervention could have such a significant impact on her well-being. You're going to be in a position where I could implement such life-altering therapies. Right? Awesome. Got it. Makes sense. And then we keep going. And we go to here, interesting little takeaway, or not takeaway, a transition. My direct impact would not always be in the form of a long-term patient relationship. Okay. So you're in a remote area medical trip. Got it. So we're kind of setting a new scene here. What's going on? You have a patient who's embarrassed, and you're waiting until the felt draped exam room in the back corner of the medical area to repeat this question that you were trying to find out some information that she was obviously embarrassed by. And so you repeat the question and all of that fun stuff. And then you come back with the physician. And again, here's where I would have loved to see that earlier. Remember when I was like, I was looking for that compassion, that impact from you. This is where, great, I can see some compassion there. You taking action, you being a part of this story and not just telling their story. So that's great. Again, these are just things that just pop out as I'm scanning through reading these. Again, takeaway part when we get to, as she wilted into tears, I wish I had the ability to follow up on her care. At that moment, I grasped the reality of a physician's responsibilities, but I did not feel scared. I felt driven. Kind of cliche discussion of like, the most common one is, I understand patients die, but I still want to do this, right? It's like, like they're going to be, being a physician obviously is a lot of responsibility. Feeling driven, feeling passionate, feeling excited, very common kind of emotions at this time. Perfectly fine. Not super, and the reason I say cliche is because it's not super, it's not your specific journey. It's a very common way of putting it. And then we get to more stories, which I love, right? So this Arctic themed floor, so great showing, great writing here. Slipping on gloves and masks, not identified of cause yet for some recurrent collapsed lung, which is interesting. We just had a family friend who was just admitted with a pneumothorax. We're like, oh, okay. The physician explaining what's going on, and you shift your attention to the patients, right? Bringing you back into this as much as possible. This is where I love the writing, is focused on you with the patient. Struck by the memory of my own family's confusion. So the little tie back of what's going on there with your dad. And this kind of first time going, oh, right. Doctors don't know everything right away. and maybe that's okay. It's not fun for patients to hear, I don't know, but that's the truth, and that's okay. Here's the ballerina and lifelong learning. There's that tie in there. Curiosity obviously is what led you down this path, tying back into the beginning. So nice conclusion here, what you hope to accomplish. So the goal of the personal statement is to help me understand why you want to be a doctor. And at the end of this, I understand why you want to be a doctor. You didn't overly sell yourself. You didn't overly talk about how amazing you are and what a strong applicant you are, all that fun stuff. You just talked about why you want to be a doctor, which is good, and kind of led me down that journey. So looking at school lists real quick, you were in state for South Carolina, right? I think you mentioned. And so we look at the other schools here. EVMS, I believe, is public. Arizona, Central Florida, Colorado, Maryland, South Carolina are your schools. VCU, public or private? I forget. Anyway, we'll leave that one. And then that's it. So you have at least 4 here, or 5, that are public schools. Why did you apply to those schools? Did you have strong reasons? Did you look at kind of their out-of-state acceptance rates, or were they schools where you're just like, I really want to go here. I know my chances is low, but I really want to go here?
I think it was a little bit of a mix of both. I looked at their stats for out-of-state acceptances, like the stats of the students that were accepted, how many. But then also on top of that, I knew if I was going to go out of state, I wanted it to be a school that I wanted to go to more than one of my in-state schools, if that makes sense.
Yeah, no, that makes
kind of strong tie to their mission and other things.
Yeah, that makes complete sense. Okay, awesome. Well, we get to the end, and I go, okay, great. I understand why you want to be a doctor from your personal statement. I see that you have the experiences, prolonged and consistent experiences in and around healthcare. You have the stats to back up your story. It makes sense. You would get 3 interviews and 3 acceptances, which is awesome. Talk about the preparation for your interviews. Why do you think you were so successful there?
I did a couple practice interviews. I also, for my gap year, I had been interviewing for clinical positions, and I feel like a lot of the same questions came up during those interviews, which was really helpful. I was talking about all the same clinical experiences, leadership experiences in those interviews, so it was kind of mini preparation for the end. I like interviews also, weirdly enough. So I think that kind of helped in the end.
Interviews, standardized tests.
Yeah, got it. Exactly. If somebody could stand in front of me and ask me the test, I could probably do great.
Nice. All right. That works. Okay. Well, I appreciate you coming on. Mission accepted, sharing your story. As we wrap up here, what final words of wisdom do you have for someone who is out there questioning their application, their abilities to get into med school, all that fun stuff?
I would say that you belong. I had the biggest fear that I was this average applicant, and you can be what you think is average and still get into medical school. You don't have to found a clinic or have a 520 MCAT or all these hours of research. If you do the things and you're passionate, you will get in. And don't have a backup plan. I had somebody tell me that I was I was immature for not having a backup plan, but I knew I wanted to be a doctor.
It's the worst advice. It literally is the worst advice. I don't understand. Like, no, a backup plan just means you're not going full bore into your primary plan. And somebody was like, well, that's just illogical. You're just going to go into a surgery without a backup plan if something goes wrong. I'm like, it's a completely different situation. Like, completely different. That would be malpractice if you as a surgeon didn't know what alternative an alternative approach is if some reason the initial approach is not going to work. Like, if you want to be a doctor, figure out how to be a doctor until there is some true, like, every single medical school in this country has said, we will not accept you. Then look at the Caribbean or go somewhere else and then figure out how to come back for residency, right? And there will always be a door open if you want. Now, obviously, there are reasons why people don't get in, and there are some people out there who literally will never get into medical school. And obviously, people have to do their own soul searching to see if it is just people telling them they can't get in, or if they have some sort of weird felony on their record that they're probably never going to get accepted. We just never know. But anyway, yes, backup plans are terrible. And even if you withdraw from physics and struggle in anatomy and physiology and take the MCAT 3 times, you too can get into medical school.